Hey everybody, it's Rachel. I'm going to do a live. I know I didn't announce this. I'm probably not going to respond as the questions roll below, but I just wanted to do this update, and I thought this would be an easier format to get this up quicker. So I wanted to give you guys an update for this week about what's going on with coronavirus and kind of some thoughts and things about it. So we're definitely seeing an uptick in cases here in Texas. Specifically, I'm in San Antonio. I have seen positive patients for it. So I do think that this is the quiet before the storm, even though we are seeing positive cases here. So we are having community transmission here in San Antonio, and that was just discovered about a couple days, like I said, it was 24 hours ago. So yeah, it's getting real. So some updates on this. I'm going to kind of go over some of the signs and symptoms now that I have seen some patients with this. Kind of go over personal protective gear and what's going on with that, and just some kind of antidotes and other things. So first and foremost, I am feeling fine. My family's doing well. My hospital does have personal protective gear at this moment, although our supplies are running low. And so what is personal protective gear? You guys hear about it, PPE, in the news media. And if you haven't been on social media or in the news, you probably are like, what are you talking about? Right now in America, we have a critical shortage of PPE or protective personal gear for our first line runners. What is that? One of that is this thing. This is an N95. This is the respirator that you see in all the videos and all the news media coming out of Italy and China, Iran, and all those places, okay? In America, we are critically short. I have my own supply that I was able to order as soon as I found out that my hospital did not have the size that fit me and it was on national back order. I was able to find one from an industrial company, and this, along with the other masks I have, are, they're golden. I'm keeping a very tight rein on these. These masks filter out 95% of the virus particles, and they're really important if we do a procedure that is aerosolizing, okay? Coronavirus, as we know it right now, is droplet, meaning if you sneeze or cough, the droplets get in the air, they fall on things, you touch that, you can get that infection. So the CDC had originally recommended that we use these higher filtering things, masks that basically seal in to protect us, and have since backed up on that restriction to just a surgical mask. Those like little blue masks that you see, they do protect against droplet. They don't protect against aerosolization, or if someone like sneezes, or you do intubation where you put a tube down someone's throat and put them on the ventilator. So the problem with that is we don't have a lot of these, and we are actually, a lot of the hospitals and friends I have in other places around the nation that are ER doctors and nurses are running out of even the surgical face masks. This is very, very dangerous. The CDC even put out guidelines on how to reuse gear. And if a hospital, heaven forbid, runs out, to make shift PPE, things like handkerchiefs, things like bandanas, which is totally unacceptable. I'm seeing reports out of Washington that they are making their own surgical masks out of leftover gowns. So it is very, very scary. I would encourage anyone, if you have these N95 masks or even surgical masks, and you've bought them and you're hoarding them and you're not in healthcare, reach out to your local healthcare people and see if they want it. I know lots of people in all different areas are asking for them, donations. If you're an industry and your company uses this, please think about bringing them back. That's the most critical thing. If I go down, if my husband goes down, he's also an ER doctor. If our nurses go down, there's nobody to take care of anybody, and we potentially could spread it to other patients. So very, very important. All right, so that's personal protective gear. Let's talk a little bit about what I'm seeing here in San Antonio. So I have personally taken care of coronavirus positive patients. And some of the symptoms that I saw and some of the symptoms that my colleagues are seeing around the country are things like fever, You've heard it like a dry cough. The people that I've taken care of so far have not been horribly ill, which has been good. But one of the things that I am seeing is they get this pattern on their chest x-ray that looks like kind of fluffy and virally. It's kind of hard to explain. We call it ground glass. So we'll see that on there. Their white cell count is very low. And a lot of them kind of have these nebulous like body aches, maybe back pain. I think 10 to 15% of the people can just be nausea, vomiting, and diarrhea. So there are people walking around that are not showing a lot of symptoms and they're spreading it. In San Antonio, we've had 6 community acquired cases where they mean they don't know where they came from or how they got them. They're not travel associated. They weren't around someone that was a known positive. I suspect there's far more. The other reason I believe this is because we don't have the testing capacity. Just recently, my hospital was able to start doing outpatient testing where we could swab and send to an outpatient lab. Well, within 24 hours, we did not have enough viral swabs to do that anymore. We can't even run flu tests if you're outpatient. And a lot of labs and a lot of hospitals and doctors' offices are having problems getting these basic swabs, so we can't test. And that's going to continue being a problem. So this is really, really important for people to stay home. A lot of states are going on lockdown, and that's actually extremely important to go on lockdown because right now, without good personal protective gear, without good ways of testing it, we need to stay home and we need to stay conscious of how we're affecting those around us. Um, I had said earlier in my previous video where I talked about coronavirus that it really affects the elderly. The data is starting to show it's actually affecting young people. I believe if it was in Italy, and here even in the US, about half of the people in the ICU are not over 60. They're under 60. There are 30-year-olds, there are 40-year-olds, there are 50-year-olds that are in having this and requiring hospitalization. I know I've taken care of some of them. There are ER doctors that are in the ICU. At least one of them is in their 40s. And if I think correctly, or I heard that one died, didn't have a lot of health issues. So although your vast majority of your 20, 30-year-olds are probably not going to die, you could still end up in the ICU for a prolonged period of time. So that is something to know. The data is still showing that small children are not affected. If you're under 10, they're not really ending up in the ICU or severely sick, but we are seeing children over 10 in the ICU. There's not been really any pediatric deaths. However, they can get sick. So it's very good that schools shut down. It's very good that businesses are starting to take this seriously. Okay, now I get to the part, the antidote. How do you ever say that? Antidotes. This is where we talk about the treatments. Well, right now there's not a lot of treatments. There's a lot of speculation in the media. I believe Trump came out and said some different things. None of those are proven. And the one thing I would say is please don't go out and try to stockpile azithromycin, Plaquenil, chloroquine, any of those. Please don't. They're not proven. We're still using them in a very limited capacity on sick ICU patients. So please don't try to go out and buy those. We don't know if they work. They're dangerous if you don't know how to use them. One of them is an HIV medication, Kaletra. That can be very dangerous to your liver if you take that willy-nilly. So please don't, because you think you might be exposed, try to get these medicines and then go on them. We still don't have anything that's truly proven. And if I hear about that, I will let you guys know. So that's kind of the basic gist. This isn't going to be a real long video for you guys, but I thought it would be good to update you where we are. I suspect by next week, I have the rest of this weekend off, but by next week when I go back to work, it's going to be a whole different thing. As of this weekend, all the hospitals in my area are not allowing visitors except for very unique situations. They're canceling non-emergent surgeries. This is really good because it's giving us more PPE. So it's going to be a totally different environment. Please keep staying at home. Please don't go to your ER if you are not super sick for testing. We can't do it. And please stay healthy and safe. So that is the big thing that I want to message again. and I'll update you guys as I get more. But that's about it. I'll look at the comments below, and if anyone has questions, I'll try to get back and answer those. But I hope this was informative. I will be getting out some other videos. I'm gonna do my FabFitFun edit sale tomorrow for you guys. So anyway, bye, and thanks everyone for tuning in. All right.